Thank you, Madam Chair, for holding this important hearing, and I thank each of our witnesses for being here today. Housing is infrastructure, and it is essential that any upcoming infrastructure package includes meaningful investments in our public housing stock. Black and brown neighborhoods like those in Mattapan, Chelsea, and Everett in my district have been historically divested from and would stand to benefit greatly from robust investments in parks, streets, sidewalks, clean transit, and better buildings. However, often when long overdue infrastructure improvements are made that could benefit Black and Brown communities, the gentrification that follows pushes them out. Ms. Gentle, as Congress considers an infrastructure package which will bring needed improvements to our communities, would coupling revitalization with investments in public and affordable housing help to fight displacement?
Yes, absolutely, Congresswoman, because as those communities would otherwise gentrify as this new investment comes in and costs increase and new people move in, that affordable housing that is either constructed or preserved in that neighborhood becomes an anchor for the long-time lower income residents who are often people of color to remain in that community and benefit from the new investments in the community.
Thank you. In fact, in my district, at least 47,000 families were on the waiting list for public housing even before the pandemic. By failing to fund repairs in the public housing backlog, every year nationwide, we have lost more than 10,000 public housing apartments because their conditions became uninhabitable. We need to be building more public housing and sustaining what we already have. The lack of repairments and improvements is also putting my constituents' health at serious risk. Specifically, there are currently an estimated 4 million households in the United States that have children exposed to lead hazards, a disproportionate number of Black children. This exposure can have lifelong consequences, including seizures, comas, and even death. I was really encouraged to see President Biden include funding to remove lead pipes in his infrastructure proposal. This is something that I've been fighting for with my friend and colleague, Congressman Chuy Garcia. We recently reintroduced the Lead Abatement for Families Act to provide critical funding for the Department of Housing and Urban Development to identify and remove lead pipes in our housing stock. It is essential that this bill is signed into law. Ms. Gentle, as Congress considers an infrastructure package, how could including funding to remove lead pipes be beneficial to both our collective public health and our pursuit of racial justice?
It's very important, and at the National Income Housing Coalition, we strongly support your bill and urge Congress to enact it quickly. Certainly any child can be exposed to lead, but certain children are at higher risk. And children of low-income families are 8 times more likely to be exposed to lead than higher income families. And there are profound racial equity issues as well. Black children are 5 times more likely to be lead poisoned than white children. Public housing is particularly susceptible to lead exposure because the developments are older, often decades old, and because some of the units are in such a state of disrepair. In 2019, HUD estimated that there are 62,000 public housing units that need lead abatement. And our partners at the National Housing Law Project have estimated that over 90,000 children who are in the Housing Choice Voucher Program have been lead poisoned. And as you say, the long-term health consequences for those children are devastating. So there is a real imperative that we invest in repairing public housing, in abating lead, so that these children in these communities, and especially Black and brown children who are overexposed to lead poisoning, have a real shot in their futures.
Absolutely. Thank you so much. I mean, our families certainly do not deserve less simply because they can't afford more. So we have to ensure that this recovery does not leave any community behind, especially those that have been disproportionately impacted, given those comorbidities. So thank you very much.
Couldn't agree
I
more.
yield.
Thank you. Thank you very much. The gentleman from Ohio.